Let's talk about crack. Don't do drugs. No, seriously though. We're talking about our first adjustment experience. Hey guys, welcome back to Chiro Coffee Chat. I'm Dr. Pete.
And I'm Dr. Carla.
Serious subject today. Let's talk about crack. No, not the street drug. Don't do drugs out there, kids. We're talking about our first chiropractic adjustment experiences. So, Dr. Carla, tell me about it. Tell our viewers.
All right, so, everyone knows about that crack pop noise that you hear when you go see a chiropractor. A lot of people have this big misconception that it hurts, but honestly, it feels pretty darn good. I've always been a migraine sufferer. At least once a week I would get a migraine, whether it was seasonal or...
What age did that start for you, do you think?
Probably around when I hit puberty.
Okay.
And kind of going through like the cyclical motions of puberty is when they all started and kind of just escalated from there. Again, always had chiropractic around me, but had never been actually adjusted myself. So my dad pushed me, said, you gotta go to this chiropractor. He's great, you'll feel so much better after. So I went, I knew that the crack was going to happen, but it was like night and day afterwards. I felt as though my head was just about to float away, like the weight of the world was lifted off my shoulders, my muscles were relaxed. It was just an incredible feeling. And of course, the pro of it is my migraines pretty much went away completely,
really
which
cool.
is awesome. I might get one every 3 months, maybe. And that's usually if I haven't been adjusted in that 3 months, but yeah, it's pretty awesome.
It's interesting because if you have a dramatic experience on your first adjustment, not everybody does, and there's various reasons for that, which we can talk about, but going into it for me too, I didn't know, I started getting migraines when I was 7,
Wow.
so very young. And now looking back, I attribute that to I was born with the forceps. I know they don't use it too much anymore, but I would have had some neck trauma as a baby, and so then started getting headaches at a young age. And I was given medications for that, but I would still get them, mm-hmm. either headaches or migraines. So, and I sort of noticed afterwards when I got my first adjustment. So I was the chiropractor. I saw Dr. Bruce Walton, an amazing chiropractor. He did the Thompson technique. Mm-hmm. So I was lying face down, and I turned my head, and he, pushed into my spine, and I felt a click, and I was like, oh, that felt good. And when I noticed when I sat up, a couple things. One is that when I would look down, I have this tightness and pulling in my neck, kind of going down my spine. I must have had that for years, and that was gone.
Wow.
Which I guess I thought it was normal, but afterwards, this is how, that's how it's supposed to mm-hmm. feel, which was really cool. And then gradually, neck pain and headaches went away as mm-hmm. I stayed under his care. But I also had that experience that you had, which was the feeling of a bit of a floaty feeling, and I noticed that my vision seemed brighter and my hearing seemed more crisp. So I probably had some kind of, definitely problems in my neck for mm-hmm. many years, which, changed after that first adjustment and have been maintained. So a lot of you, if you haven't been adjusted, you might be people are afraid of how it's going to feel. It might mm-hmm. hurt. The popping sound, what is that? The popping sound is gas being released in yes. joints when joint surfaces move apart.
Not actually bones.
No, not bones cracking or crunching. That'd be scary. Who wants to sign up for that? Not me. It's a different. You have to experience it, I guess is what I'm trying to say. But I will say too, if somebody comes in, if they're in a lot of pain, mm-hmm. if they've got a lot of inflammation in their body, an adjustment could be a little bit uncomfortable, and that's where we would use our skills to be really gentle with people and ease them into it, and not try to, create a huge change in one visit, because it would be too much for them, mm-hmm. right? So, yeah. So
there's lots of different techniques that
absolutely.
We can utilize in order to get you to the point. Maybe there is never a crack you hear, but there are many techniques right. that will give you the same outcome as that crack adjustment that people hear.
Absolutely. So, thanks for watching, guys. If you have any other questions or comments or things that you would like us to talk about, please let us know in the comments, and we will see you on the next video. I'm Dr. Pete.
Dr. Carla, have a good one.